Today we are going to talk about non-surgical rhinoplasty or nose reshaping. We will have another segment on rhinoplasty, on the surgical rhinoplasty, but this week we're going to focus on some non-surgical treatments and how we use fillers mainly to address the nose. Before we get started, I just want to let everybody know that we are planning on getting back to normal business or somewhat normal business the first week in May 1st, May 2nd. And we will be following all the precautions, social distancing. Our lobby is already set up, so people will be 6 feet apart. The doors will be propped open, so you won't have to touch anything. If you want to wear masks, we've got hand sanitizer everywhere. Our providers may wear masks, may not. If you are interested, if you're not treating this part of your face, we will offer you masks as well. But we're not terribly concerned about that because we are an accredited surgery center and we follow normal guidelines anyway. The only thing that might be an exception is we will likely, as we get started, take your temperature. We're going to take everybody's temperature, our staff, probably twice a day, just so we can monitor things. I think that we've all been through this process. I'm not sure how you're feeling, but we are very eager to get back and start taking care of you. So with that, today we're joined by Karen Whitney and Hope Mers, and we're going to talk about non-surgical rhinoplasty. It's a topic that we do see patients for, and I'll probably have a few things to say in comparison to what we can do surgically versus non-surgically today, but I'm going to turn it over to our wonderful team and let them take it away.
So Karen, do you want to start off by maybe talking about how fillers are used to treat the reshaping of the nose?
Absolutely. So most people probably know that we use injectable fillers really in almost every area of the face. And what you may not be aware is that we can also use small amounts of filler in the nose to accomplish a few different things. Sometimes a patient will have a deep crease at the top of the bridge of their nose. It might be associated with frowning, but it might be there at rest and really not related to those frown muscles pulling down and in which case we can very carefully place a few drops of filler right under that crease to help lift and support the area. Along that same line, if we see someone who from the side has a little bit of a hump, a dorsal hump of the nose along the bridge, we can put a little bit of filler up above that hump right on the bridge to create a smooth line as opposed to a contoured humped up line. And that's probably one of the most effective uses for filler that I see on the nose, is that from a side profile, the contour now is smoothed, and that it gives the illusion of having had a rhinoplasty or surgical revision of that hump, but at the same time it's very easy to perform in the office. The other thing we see is asymmetry of the nose. I can talk to that. I had the handle of a shovel hit me right here, so I have a little bit of a divot. I don't think anybody notices, but if it bothered me, I could actually place a little bit of filler right in that area where the soft tissue was damaged years ago. Sometimes due to a past surgery, maybe someone had a basal cell removed from their nose and there's a little asymmetry. We can sometimes correct surgical asymmetries, as well as just those associated with perhaps how the patient uses their facial expressions. So these are small tweaks. We're not using a lot of filler. The products will last typically 6 months to a year and a half, depending on how much we've used and what product we've chosen. And so it's a pretty easy treatment for patients who want to tweak their appearance without doing anything surgical. Dr. Mendelsohn, what would you like to add to that in terms of shaping the nose?
Sure. So I think that non-surgical rhinoplasty, for some of these irregularities, fillers are really a wonderful option for us. I want to stress a few things, and then I want to talk about ideal candidates for this and really what we can do for it. So first of all, let me start with the safety part of it. This is absolutely an area where you want to find an experienced injector. There are a number of blood vessels that come up from the angle of our jaw called the angular artery, and it goes right back next to our nose, and it goes right back to what's called the cavernous sinus. And so we want to be very careful about what we're doing, and so you definitely do not want this done in a med spa. Botox may be one thing, but definitely not fillers in this area. So that being said, fillers really can be wonderful. The ideal candidate for these non-surgical rhinoplasties are someone with what we describe as a platyrrhine nose. Asian, African Americans commonly, where the nasal dorsum is lower, and we're performing an augmentation rhinoplasty, and that is we're placing some filler in that area to help strengthen the dorsum and help contour the nose. The patients that Karen are talking about, we use fillers in when there is an irregularity of the profile. There's a balance sometimes, because if you've got a large bump and a larger nose, yeah, we can fix the contour by filling in filler above or below that area, but we don't want the nose to become larger and larger. So non-surgical rhinoplasty is not for everybody. It's definitely something that you need to be evaluated for to make sure. These days, even patients who've undergone rhinoplasty in the past, unfortunately there are many patients who have had rhinoplasty in the past who have some irregularities, and rhinoplasty can be quite challenging. But in certain revision cases, non-surgical rhinoplasty, or tweaking it along the alar rim, or irregularities like she got hit by a shovel, but people may have contour problems, that's an ideal circumstance to use injectable fillers as well. So as you already know, we use fillers all over the face. I think some people are unaware that we actually use it in the nose, but not everybody is a candidate for rhinoplasty here. Benefits, obviously, it's relatively easy, that is from a patient perspective, but we do need to be very careful, and you absolutely want to make sure that somebody with experience is injecting this area. You know, I don't know, Hope or Karen, I don't know if you guys want to talk about other things that we see in the skin. Often we might see patients who've had Mohs surgery, or a scar, or acne, or rosacea, or other issues that we're managing the skin for, or as Hope just talked about, the caveman look. So I don't know if you want to talk about some other things that we can do around the nose as well.
Sure. So thinking about the nose and skin conditions, I'd say the top most common that I hear is blackheads and pores. So that is a common complaint. Blackheads are frustrating. Pores continue to look larger as we age because we're losing collagen. And so as the collagen depletes underneath the pore, even though the pore itself isn't bigger, it looks bigger because it's giving a deeper appearance. And so those two things, there are many treatment options for. Blackheads in particular, you want to make sure that you just keep your pores nice and cleared out. So we use certain things that are called keratolytic agents, agents that are going to break up keratinocytes and different things that are stuck inside these pores. So we like to use retinols. Retinols are great. They are like retinoic acid, but they have a little fatty molecule around them that pulls them down into the skin, so they're more tolerable, so they're not as irritating. Many people can use them. There's different strengths, and that will help break up the junk in those pores and keep them nice and clean. The other thing you can do for that is something like a chemical peel. If you're not able to tolerate retinols or retin-A's, that is a great option. Chemical peel is, you know, very easy. Our esthetician, Wendy, is excellent. She will look at your skin and see, you know, what you'll be able to tolerate in regards to a chemical peel and the formulation. And
Did you guys lose Hope, or is it just me?
using a pen that's about the size of a Sharpie, has these teeny tiny needles that go in and out really fast. They're so small that you can barely see them. It's not painful. We do use a topical numbing agent prior, just so you're as comfortable as you can be, but we can rub that little pen around, and breaking up those little pores with these micro injuries really helps over time and over a few treatment series to reduce the pore size. So that's a great option. Beyond that, there are more aggressive ways to treat those with like a dot laser, an ablative resurfacing laser treatment. So that can always be utilized as well. But typically we start with some microneedles, and that will generally give you a good improvement. So I'd say blackheads and pores definitely are an issue on the nose. Another thing is, I mean, this area gets a lot of sun. The sun likes to hit that projection of our nose, and we do commonly see precancerous and cancerous lesions appear on sun-exposed areas like the nose. So that's something we want to look out for. Typically that will look like a pink flaky patch that won't go away, or a little pearly kind of bump that's new and shows up, you know, not later in life, but in your, you know, 30s, 40s, 50s, where you shouldn't have an acne too often, and it shouldn't stay for more than, you know, a week or so. That might be a bump that we want to look at, because we can always do a little shave biopsy, which is super easy. And if it is a skin cancerous lesion, we can always remove that with a surgical excision by, you know, the best plastic surgeon. And we can work in conjunction with a Mohs surgeon if needed. Mohs surgery is where you would be sent to an office that we work in conjunction with, where they have a Mohs surgeon who takes out the skin cancer, goes and looks at that specimen underneath a microscope, and makes sure that all the cancer is gone from the whole edges of that area. Once he confirms that your skin cancer is gone, you come back to us, and we can either utilize a graft, taking some healthy skin from behind the ear to replace that area that was taken out, or close that area in a different fashion so that you have a beautiful cosmetic result after the scariness of having a skin cancer in general, but especially on the face, and especially in a small area like the nose. So we do oftentimes work with patients and other physicians to work with skin cancers on the nose, which turn out very well. But yeah, is that kind of what you thought, Dr. Mendelsohn?
Yeah, so yeah, and with regards to, you know, so Hope is talking about, I was going to call you Snow. Hope is talking about a skin graft, and we do take it from the postauricular area behind the ear, sometimes around the clavicle. Sometimes what we'll see, and we're not the ones always doing the reconstruction because many of the Mohs surgeons do it themselves, but you may have had this, and the graft might have pulled away a little bit, so you might have a little scar, a little indentation, and sometimes with a little bit of filler, those things can be improved as well. So there are a lot of irregularities that we see. The classic non-surgical rhinoplasty, I think really, again, is someone with what we describe as a platyrrhine nose, someone with a flatter nasal dorsum, where we're adding some fillers too. But we do use these. We're going to talk about rhinoplasty in a prior segment. We talked about miraDry and what is the connection. People who sweat for excessive sweating, people who have rhinoplasties, and people who have otoplasties, have their ears pinned. Those can be really wonderfully wonderful procedures from a psychological standpoint in terms of giving somebody more self-esteem and confidence. And so something like this in the appropriate candidate, same thing, no surgery, no recovery. You're in the office 15 minutes later, you know, you have this, your nose reshaped. So, so those are some nice things there. You guys, anything else that you'd like to contribute?
I know in a later segment, we're going to go over some rhinophyma, which is it's a nose condition. It's a subset of rosacea where the nose can kind of overgrow throughout the years. So we can go into that further at that time. Another thing that's very common to happen on the nose, as Karen Whitney was discussing a little bit with me earlier today, is these little vessels that form on the sides and the tops of the nose and cheeks and rest of the face from just having a red tone in the skin. So we can always treat those with IPL laser, intense pulse light as well. So that's something that we can easily maintain throughout the years with an intense pulse light.
Very good point. Yes. Karen, Whitney, anything?
No, that's it. Sometimes those blood vessels by the nose are incredibly resistant And if they're a large enough size, so that sometimes I actually inject them and do just a drop or two of sclerotherapy, injecting a very concentrated salt water into the vein to make it shrivel and shrink. So they can be stubborn. My vein studies revealed that those are the highest pressure veins in the body, those little guys right by your nose. So
Interesting.
yeah.
All right. Well, thank you guys. Kind of a brief subject today, but an important one for many people. So a few reminders. We'll be back tomorrow, first of all, but through the month of May, we are having a Botox promotion just to get us all through this COVID stay. We've got a lot of demand, but we're going all the way through the end of May with $9.99 per unit. We're still seeing patients for virtual consultations, all three of us, Hope, Karen, and myself. So feel free to jump online. Otherwise, I think that we will just plan to see you tomorrow. And thank you for joining us, and we'll see you then. Bye.
Thank you.
All right.